What if your next doctor isn't human? Would you trust your life to a machine? It sounds like the beginning of a science fiction movie, but it's not. Across the United States, artificial intelligence is already reshaping healthcare. From virtual checkups to algorithms diagnosing illnesses, a silent but powerful transformation is underway. And it's not about the future, it's happening now. This is the rise of AI-powered telemedicine, a system where machines don't just assist doctors. Sometimes, they are the doctors. But what exactly is telemedicine with it? At its core, it's the fusion of remote healthcare and intelligent technology. Instead of visiting a clinic, patients can consult with AI-based platforms from home. These platforms use sophisticated algorithms to evaluate symptoms, process medical histories, and suggest possible diagnoses instantly. Some systems scan your voice, facial expression, or even typing speed to detect signs of stress or illness. AI-powered chatbots are now the first point of contact in many digital clinics. They ask questions, analyze responses, and guide patients, all before a human ever steps in. Meanwhile, wearable devices constantly monitor your vitals, heart rate, oxygen levels, blood pressure, even sleep patterns. This data feeds into AI systems that can detect early signs of chronic diseases or sudden health threats. This is not just convenience, it's a new medical ecosystem. In the US, leading institutions are embracing this change. The Mayo Clinic uses AI to assist in cancer detection. Stanford Health uses algorithms to identify heart conditions from ECG readings with impressive accuracy. At the Cleveland Clinic, AI helps predict patient readmission and optimize treatment plans. These are not prototypes. They're operational tools in real hospitals. Apps like Babylon Health and Teladoc have also entered the mainstream. With millions of users, they allow anyone with a smartphone to access AI-guided healthcare. Teladoc, for instance, combines human professionals with AI assistants to triage and route patients more efficiently. The pandemic only accelerated this shift. When hospitals were overwhelmed and physical visits were limited, AI-based telemedicine filled the gap. It wasn't just a temporary solution. It became a glimpse of how medicine could work permanently. So, what are the advantages? First, speed. Patients no longer have to wait weeks for an appointment. AI tools offer immediate feedback. Second, accessibility. People in rural areas or with limited mobility can now receive care that was once out of reach. Third, cost. AI can reduce operational expenses for hospitals and insurance providers alike. And fourth, perhaps most surprisingly, accuracy. In specific tasks, like analyzing medical images, AI can outperform humans by spotting subtle patterns invisible to the eye. But this technological leap also raises serious concerns. Machines don't feel empathy. They don't read between the lines of a patient's tone or pick up on cultural nuances. In critical care, human intuition and emotional intelligence still play a vital role. And what if the AI gets it wrong? A misdiagnosis from a machine could be catastrophic, especially if there's no human to verify it. Ethical questions also emerge. Can we allow algorithms to make decisions about treatments? Should they be allowed to deny or approve procedures based on cold data? And what about privacy? These systems collect massive amounts of personal health data. Who owns it? Who protects it? Then there's the question of inequality. Will high-quality AI healthcare only be available to those who can afford it? Or can it truly democratize access to medicine? Looking ahead to 2025, experts predict even deeper integration. AI systems will become standard in electronic health records. Virtual doctors will handle routine consultations. And in some areas, there may simply be fewer human doctors available for basic care. But perhaps the future isn't about replacing humans. It's about redefining their roles. Doctors may spend less time diagnosing and more time connecting with patients. Nurses may focus on empathy and care, while AI handles the technical tasks. Ultimately, it's not a question of if AI will change medicine. It's a question of how far we're willing to go. So now we ask you, would you let a virtual doctor treat you? Drop your thoughts in the comments below. Would you trust your health to an AI? And if you're passionate about the future of technology, healthcare, and innovation, make sure to subscribe. There's a lot more ahead, and we're just beginning to understand what intelligent medicine can do.